Hello, my dear doctors. This is Dr. Azam here, your faculty of anatomy at PrepLadder. And now we are going to discuss all the questions that has been asked in your recent FMG exam, which was conducted yesterday. So July 2025 exam, which was conducted on 26th July. So now we are going to discuss all the questions that has been asked in anatomy, and of course the related concepts with that one. Yeah, very good evening, everyone. I hope I'm audible and visible to all of you. Thank you, thank you. And as expected, in yesterday's exam also, like there were like expected questions in anatomy. But what I've observed, main important thing is there were like many of the questions which were overlapping with the other subjects and all. I mean to say they're integrated questions which are given. So so we do have like the questions which I told you about, the important questions or the important topics in anatomy. Apart from that, there were like a lot of integrated questions in that one. So let us discuss about all of them one by one, and do let me know if there's any change in the language of the question or is any change in the options there. So whatever questions we got, of course, they are actually the recall questions from the students. It might not be exactly correct. So please let me know wherever possible, and then I'll make the changes in that one and we'll come up with the final questions in the app. Fine. So let's get started with the very first question here. A 30-year-old man came with the choking episodes after ingestion of fish bone while eating. Fine. The fish bone got impacted at the level of T4. Now this is something important. At the level of T4 in esophagus, which is most likely site of the obstruction. Guys, when it comes to the esophageal constrictions of the esophagus, I told you just like, couple of days before the exam also, I conducted a session on PrepLadder's YouTube channel where we have actually named the session as Countdown to Conquer. In that session, mainly I told you the expected questions, and in thorax topic, I told you constrictions of the esophagus are utmost important. They are giving those questions in a various ways, in a different ways in the exam. So remember, if it is given at the level of T4, there is an impact in the esophagus, that too in the esophagus. So at the level of T4, the best answer should be the arch of aorta, aortic arch. So we'll be measuring like 4 different constrictions in the esophagus. So with respect to, or with the reference of what incisors there. So you know very well at the level of T4, you'll be actually having the arch of aorta. So that is a more better answer. Yes, if there is an impaction at the level of T4 there, sir. Perfectly done. Now moving on to the next question here. A man fell on his shoulder with his head pushed in the opposite direction. Exactly the same words I told you. A man falls on the outstretched arm. That is a word that I used you in the expected question series. So a man fell on his shoulder with his head pushed in the opposite direction. He presented with the following deformity. Which nerve root value are most likely affected in this one? The moment you look at this image here, we know very well it is Erb's paralysis. And when it is Erb's paralysis, the root value that will be involved here will be C5 and C6 will be involved here. No doubt about that. It's a straightforward and simple question here. In this diagram, the sign that you're able to observe here is actually the policeman's tip hand, which is also known as the waiter's tip hand or porter's tip hand, where you are going to see the arm is actually adducted and medially rotated, and then the elbow will be actually extended here, and the forearm will be pronated, and you can see the fingers are actually flexed here, and that is representing the policeman tip hand. And in policeman tip hand, yes, that is a sign for Erb's paralysis. The root value involved will be C5 and C6. Perfectly correct. That's an easy question. Fine. Moving on to the next question. Yes, there was a question from embryology, and as usual, like every time we say, there'll be definitely one question coming from the embryology related to nervous system, central nervous system, CNS embryology. So which structure is formed by the structure indicated by the arrow mark here? See, this diagram we have drawn like n number of times in our classes also. So for example, if this one is your ectoderm here, and if this one here will be the endoderm here, and in the middle you'll be having mesoderm. So if this is ectoderm, and if this is the endoderm, and in the middle you'll be having the mesoderm here. Now here you'll be able to appreciate one structure, that is your notochord. And notochord is going to induce the overlying ectoderm here to form a tube, and that tube here will be the neural tube here, sir. So this one here, you just imagine this one to be the neural tube. And then what is going to happen, my dear friends, here, there will be mesoderm, and that mesoderm is in turn divided into like 3 parts over here. The one which is very much closer to the notochord, this one is referred to here paraxial mesoderm. This one here will be the paraaxial mesoderm. And this one here in the middle will be the intermediate mesoderm. And then here, this one will be the lateral plate mesoderm. Lateral plate mesoderm. Now coming to our main important thing here, this is actually the notochord here. Notochord is going to induce the overlying ectoderm to form the neural tube. Fine. Now here, if you look at the options here, probably they might be indicating towards the remnant of the notochord. Like after forming the neural tube there, what is going to happen to the notochord? Notochord is going to, yes, remain as a remnant, and that remnant will be actually the nucleus pulposus here. So the nucleus pulposus should be the right answer. Yes, if you can just recall the exact terminology that is used in the question, it is actually the formed or the remnant. Yes, if you can recall, are they asking the structure which is arrow marked here, what is the remnant of them, or what it is actually forming? So if you can recall the exact language of the question, that will be more better. Fine. So if they're asking you the remnants, I said you very clearly in our videos in the PrepLadder app that there are like three important remnants of the notochord that you have to remember. Number one, nucleus pulposus. Number two, there will be apical ligament of dens, and then they will be having the membrana tectoria, or simply tectorial membrane. So these are the three things you got to remember. Spinal cord is in the option 2. Okay, fine. I'll include the spinal cord also here. But of course, spinal cord will not be formed from the notochord. Remember, spinal cord, it is actually a derivative of your neural tube only. Neural tube is the one which is going to form your central nervous system, that is your brain, and the spinal cord will be derived from the neural tube. So spinal cord is the option. Of course, that will not be the option. The right option here will be the nucleus pulposus. I mean to say the remnant of them. Okay, fine. The arrow mark was correct and don't remember the question. Okay, Dr. Ajinkya. Yeah, of course. If the notochord is given, the remnant of that one will be the nucleus pulposus. Fine. Then let us move on to the next one here. Yeah, thank you, Dr. Meghna. Thank you. Yes. Now in this question, observe very carefully here. Normally, the question regarding the palmar spaces is not asked in the FMG exam. So I have seen this like after like so many years that they have been asking about the palmar spaces and all those in your FMG exam. So let us discuss this one here. A diabetic worker sustains a stab injury to the central region of the palm. After 3 days, he develops a swelling, severe pain, and inability to extend the middle and the ring finger. Inability to extend the middle and the ring fingers over here. Pus accumulation is suspected in one of the palmar spaces, and which of the following spaces is most likely involved? See, when it comes to the palmar spaces, the mid palmar space, which is marked B here, the mid palmar space, which is marked actually B here, my dear friends, remember that will be present below this tendons over here. There you are able to see this tendons here, which will be actually supplying to your middle finger, the ring finger, and these tendons which are passing to this one, just beneath that will be actually having the mid palmar space. So when the hint is very clearly given here, yes, it is affecting your middle and the ring finger over here, it should be definitely the mid palmar space that is actually involved. The C which is given here in the image, that is actually the thenar space over there, and that is going to affect the movement of the thumb, but that is not given in the option. So not given in the question. So based on the question which is actually given here and the hint which is given here, which is affecting the middle and the ring finger, the correct answer has to be the mid palmar space. The mid palmar space over here. Fine. Shamim Ahmed is telling, sir, all the option was on the spinal structure. Okay, fine, Shamim, you can actually drop that options to me. I'll correct that and get back with the exact options and the exact question in the final thing that will be uploading in the app. Okay, so done. So this is B, absolutely correct. That's correct here. Now moving on to the next one, it's actually a repeat question, and this is like the third time they have given like the copy paste question. I mean to say they're repeating the same question every time. Third time in FMG exam they have repeated the same question. So in the given X-ray of the foot, the structure indicated as below here is actually your navicular bone, no doubt about that. In our regular classes, we do draw the diagram of this one here. You know. So first of all, the big heel bone here will be your talus. The big heel bone here will be the calcaneus here. This one here will be the calcaneus here. And this one here will be the talus. Right in front of the talus, there will be a boat-shaped bone, and that is nothing but the navicular. And on the lateral side, you'll be able to appreciate the cuboid, and then you'll be having the three cuneiform. So these three will be the cuneiform. So that is my main intention actually in the classes, that I make the students draw this diagram so that, you know, if this is given as an image based question, they can easily identify this one here. So these are all your tarsal bones here, the 7 tarsal bones in each foot, the calcaneus, and then you'll be having the talus. And then in front of the talus, there will be boat-shaped bone, that is your navicular. And then on the lateral side, you'll be having cuboid. And then on the medial side, there'll be like 3 cuneiform. And yes, of course, you can easily identify that is the navicular which is given there. It's a repeat question. Fine. Yeah, Dr. Zameen Ejaz, we have already discussed in the embryology question, that is about the notochord. And if they're asking the remnants of the notochord, I told you very clearly, there'll be like 3 remnants of the notochord. And one of the remnant which was given in the options was nucleus pulposus. Nucleus pulposus that you find in the intervertebral disc in the central part. Fine. Now moving ahead, which is the narrowest part of the adult laryngeal airway? As I told you in the very beginning, that there were so many questions which are actually integrated with ENT and ophthalmology when it comes to the anatomy part, I'm telling you. So which is the narrowest part in the adult laryngeal airway? Of course, the answer here should be, yes, it should be the glottis. Yes, that is actually the narrowest part in the laryngeal airway in adults actually, in adults. If they are giving in infants, then the answer will actually change. So it will be actually the subglottic region. Fine. But in the adults, remember, yes, the glottis is actually the narrowest part. Yes, Dr. Nikhil Singh, option C, Dr. Sunil, option C will be the right one if it is for the infants, not for the adult. For adults, the narrowest part will be actually the glottis. Fine. Surely, sir. Next one. A man sustained a trauma on the lateral side of his right knee. Now, this is like purely anatomy question. Observe here very carefully. During this time we have conducted many sessions on PrepLadder, that we have done the rapid revision and all those things. Yes, everywhere we have discussed in detail about the sciatic nerve in the lower limb. In fact, just 2 days before also, I told you in the lower limb, please revise like sciatic nerve and go to the exam. There'll be one question coming from there. Fine. Look here now. A man sustained trauma on the lateral side of the right knee. Okay. 2 days later, he complains of difficulty in walking as his toes keep dragging on the ground. Fine. As his toes keep dragging on the ground. That means it is indicating of what here? It is an indication of foot drop here. And if it is foot drop here, of course, we can be expecting the deep peroneal nerve to be gone. The deep peroneal nerve is injured. Fine. He also notices numbness over the lateral aspect of the leg and dorsum of the foot. So there is a loss of sensation on the lateral aspect of the leg and dorsum of the foot. I told you very clearly. Dorsum of the foot, the skin will be actually supplied by superficial peroneal nerve. If you remember, in the foot, only the skin in the cleft between the first toe and second toe, the skin in the cleft of first toe and second toe will be supplied by deep peroneal nerve. But whereas the entire dorsum of the foot will be taken care by the superficial peroneal nerve. So by these two statements, it is indicating that, yes, of course, the deep peroneal nerve is also involved here, as well as superficial peroneal nerve is also involved here, indicating that the common peroneal nerve has to be the most likely nerve to be injured over here, sir. So the common peroneal nerve has to be injured over here. Yes, of course. Yes, Dr. Prakhar Singh, there were like 2 questions from the common peroneal nerve. One question was this one here, the clinical question here. I hope you have understood this one very clearly, my dear friends. So one thing they are telling about dragging of the foot toes on the ground, that is indicating a foot drop, which will be involving the deep peroneal nerve. And then the loss of sensation over the dorsum of the foot, indicating superficial peroneal nerve. Of course, the nerve that is most likely to be injured has to be the common peroneal nerve out of the options which are given here. Fine. Yes, of course. Very good. Now, deep was not in the option. Okay, fine. We'll remove this from the options here. You tell me like what was the right option there. Thank you, Dr. Patel. Now moving on to the next question. Yes, actually this was the question that you were telling about, Dr. Prakhar Singh. Injury to which part will limit the dorsiflexion? See, dorsiflexion of the foot. Dorsiflexion of the foot is nothing but which muscles are going to help in that one? The muscles present in the anterior compartment of the leg. Extensor hallucis longus, extensor digitorum longus. Yes, you'll be having those muscles in the anterior compartment, and they're actually helping in what? Dorsiflexion of the foot there. Dorsiflexion mein help kar rahe hain. Now, all the muscles present in the anterior compartment of the leg, they will be actually supplied by deep peroneal nerve. Okay, they'll be actually supplied by which nerve here? Deep peroneal nerve. Fine. And that is of course the branch of which one here? The common peroneal nerve. And we have learned this many times in our classes and all, that the common peroneal nerve is going to take a turn, yes, around the neck of the fibula. So the common peroneal nerve is going to turn around the neck of the fibula there, and after turning from there itself, it is going to divide into the deep peroneal nerve and the superficial peroneal nerve. So in the given image, yes, the mark is yes, point B over here, and that is the place where the common peroneal nerve is, yes, most commonly injured also. I told you very clearly in the classes that the common peroneal nerve is going to come exactly near the neck of the fibula, and there it is very much superficial. So whenever a person is getting a hit from the lateral aspect of the knee, that is what is given in the last question in the clinical question. Yes, he is getting a hit from the lateral side of the knee. So the nerve which is going to go near the neck of the fibula, that is your common peroneal nerve, is most commonly injured, and yes, that is the reason why it is going to limit the dorsiflexion. So whatever feedback I got from the students, they were like, two questions based on the common peroneal nerve. Yeah, there were the two questions on this one here. Fine. Sure. A was given on the epiphysis on the fibula and B was given slightly below that one. Okay, Gupta. Dr. Gupta noted. Well, it is very good actually. So one of the arrow mark was given here, A, fine, at the head of that one, and then another one was near the neck of that one. Fine. Appreciate that one. Yes, next one, my dear friends. Now moving on to the next question, upper part of the unsenate process attaches commonly to. Now this question is actually again the same thing with the like integrated with the ENT wala part, but still I tell you one thing, that this question was also like a bouncer question to you people in this FMG exam. Why? Because normally this is not given in the FMG as well as in the PG's exams also it is not given. Okay, now fine. So whatever if it is given here, we need to discuss. And of course, every time it will happen in FMG exam that out of all the 300 questions, few questions will be there which will be like bouncers and where you don't have to worry much about that one. मतलब ऐसे सवाल के बारे में आपको सोचना ही नहीं है. मतलब आपको नहीं है, सबको नहीं पता है. It's not only you, but everyone does not know about this one at FMG level at least. Okay. So upper part of the unsenate process will be attaching commonly to. See, actually what happens is the upper part of the unsenate process, if you learn in the lateral wall of the nose, the upper part of the unsenate process will be attaching to three structures. One, onto the medial wall of the orbit over here. Number two, to the base of the skull there. And number three, to the middle turbinate. So out of these three, the option which is actually given here is actually the middle turbinate. So we need to select this one over here. So upper part of the unsenate process, I repeat again, it can be attached to three places, my dear friends. Number one, the medial wall of the orbit here. Number two, to the base of the skull. And yes, of course, yes, number three, to the middle turbinate. Middle turbinate there, guys. Okay, now. So these three should be there. Fine. It will be attached to these three. But if it is not given in the option, then we can actually go for the middle turbinate. These are the options. Yes. Yes, of course, of course. I told you already it is an overlapping question with the ENT. Might be discussed over there also. There was an option about the base of the skull, and yes, lamina praparesia was also given there. Fine, 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 fine. Biochemistry is already discussed. Fine. Now, in the given image, which vein is mainly affected here, my dear friends? You are able to see in this given image there, that is varicose vein. And in the varicose vein, the vein which is actually getting affected here, according to this given image, is actually the great saphenous vein here. अगर आपने ये आंसर मार्क किया है, absolutely correct over there. Now moving on to the next question here. A patient presented to OPD with ophthalmoplegia and as well as ptosis also. Diagnosis of superior orbital fissure syndrome has been confirmed. And which nerve are compressed in this case? Yes, what are the nerves which are going to pass through the superior orbital fissure? Superior orbital fissure से कौन सी वाली nerves यहाँ से pass होती है? Exactly those nerves which are going to supply to your extraocular muscle. And we know very well that world famous formula SO4, LR6 and restol by 3. So all those nerves are actually going to pass from here only, from the supraorbital fissure. Yes, cranial nerve number 3 and then the cranial nerve number 4 as well as the cranial nerve number 6. Okay. Then apart from that, even the branches of phi 1 will also pass from here. I mean to say ophthalmic nerve, there'll be like 3 branches. And those 3 branches are nothing but the frontal nerve. And then there will be the nasociliary nerve. Nasociliary nerve. And then you'll be also having the lacrimal nerve. So the frontal nerve, the nasociliary nerve and the lacrimal nerve, these three are the branches of phi 1. That is ophthalmic nerve, and all these are passing through the superior orbital fissure. Of course, along with the ophthalmic veins. Of course, along with the ophthalmic veins are going to pass through the superior orbital fissure here. Fine. So cranial nerve number 6 was there in all the options. Okay, fine. So cranial nerve number 6 is present over here. Cranial nerve number 6 is there here also as well as here also. Fine. Anything else? Okay, cranial nerve number 6 is given here. Fine. So if you observe here, if they're giving you the superorbital fissure, these are all the structures passed. And yes, of course, we have discussed in detail about that thing also. Yes, near the superorbital fissure, you'll be able to find the tendinous ring of Zinn. And you got to learn what are the structures which are going to pass inside the ring and outside that one. And there is a famous mnemonic for that one, like LFT. Left is left outside. So in that LFT, L stands for the lacrimal nerve, F for the frontal nerve, and then T stands for your trochlear nerve, the fourth one. You know? So LFT is left outside the ring. So, but whatever it is, all the structures are going to pass through the superorbital fissure. So those will be involved. Okay. Yes, those will be involved there. So therefore, yes, the option A will be absolutely correct here. These nerves are the one which are going to pass through the superior orbital fissure here, through the superior orbital fissure. So these nerves should be actually involved there. Fine. Then moving on to the next question there. A patient presents with a fish bone stuck in the pyroform sinus. This was exactly the same question which was given in the INI-CET exam recently, which was conducted in May. So this year, 2025 INI-CET exam, same question was actually given. A patient presents with a fish bone stuck in the pyroform fossa. Yes, during the removal procedure, there is accidental nerve injury, and which nerve will be passing from here? It will be the, yes, internal laryngeal nerve, which is actually a branch of the superior laryngeal nerve. That is what you have to remember. Okay, the pyroform fossa, or it is also referred to as the smuggler's pouch also. Yes, that is a place where the fish bone will be stuck and the pain will be actually sensed via a nerve, and that nerve will be actually your internal laryngeal nerve, which is a branch of superior laryngeal nerve. Exactly the same question was given in the INICET exam. So nowadays the take home thing for you people, my dear friends, all my FMG students who are going to further prepare for your December exam, number one thing is conceptual studies is very much important. Mugging up and all those things are not going to help. Number two, second take home point from here is that integration is very much important here. And third thing, yes, no more difference between NEET PG, INI-CET as well as the FMG exam nowadays. We are seeing from last 2-3 exams that they have been giving the questions to almost the same standard as that of that one, like NEET PG. So don't keep your preparation to a lower level, thinking that only FMG type of questions will be coming in, all those things. So don't keep it like that. Please, the third take home point from here is please always try to revise or see the PYQs of even the NEET PG also. NEET PG, INI-CET also PYQs. At least bare minimum I'm telling you, for at least the last 3 years. 3 years PYQs देखना बहुत जरूरी है. और recent मैंने discuss किया था recall questions INI-CET में exactly same question आया था. Yes, this was given there, sir. Fine. Okay, whatever options were given there, we know the correct concept here. It is actually the internal laryngeal nerve, which is a branch of the superior laryngeal nerve. I have mentioned here. Yes, you can actually take it as internal laryngeal nerve, definitely passing from the pyroform fossa there. That is important. So please take it about this one, my dear friends. Moving on to the next one, it's a direct question here, which we have discussed in the cranial nerves also. A patient presents with a down and out eyeball. The down and out eyeball with the ptosis. Yes, it's a direct question here. It will be involving which nerve palsy here? The third nerve palsy here. And we have discussed this one not only in the cranial nerves, we have also discussed, yes, in the PrepLadder app, you can actually go and check when I've discussed about the syndromes, the midbrain syndromes. All the brainstem syndromes we have discussed over there, midbrain, pons, medulla and all. In the midbrain syndromes, of course, the Weber syndrome and Benedict syndrome and all, we have discussed in detail about this third nerve palsy, where there will be down and out eyeball with the ptosis over there. Yes. Next one here. Yeah. Now here, I got like some keywords regarding 3 questions, my dear friends, but not the exact question and exact option. Actually, the students told me that there was a question about the Frey syndrome, and in the Frey syndrome, in the question, they have mentioned about the Frey syndrome, and the options actually the signs were given, like there was redness and swelling. Yes, of course, gustatory, sweating, flushing. Yes, during the meal, these words were mentioned in the Frey syndrome. Now I'll do one thing. Whoever students are going to attempt the exam in the December, it will be helpful for them. We'll discuss the concept here, what exactly is happening here. Normally in Frey syndrome, what is going to happen? Auriculotemporal nerve. Auriculotemporal nerve is the one which is finally going to supply to the parotid glands. Auriculotemporal nerve is finally going to supply to the parotid gland. So what is happening like in people like you and me normally right now? In normal people like you and me right now, whenever we are going to eat the food, what is going to happen? Auriculotemporal nerve is going to stimulate the parotid gland. And yes, of course, the parotid gland is going to secrete the saliva over here. Fine. Now what is going to happen? For example, if this auriculotemporal nerve is actually injured, If this auricular temporal nerve is injured, then what is going to happen? So during parotidectomy, what is going to happen here? Yes, that is gone. Now what is going to happen is this auricular temporal nerve is trying to regenerate here. When it's trying to regenerate there, what is going to happen? This auricular temporal nerve most commonly goes and joins with, yes, it is going to joins with, yes, the great auricular nerve. The great auricular nerve. Yes, another very trending nerve in your exams nowadays. I told you in the recent just 2 days before the exam, I told you in the expected questions, great auricular nerve पर जैसे तैसे सवाल पक्का आएगा आपके एग्जाम में. Definitely they'll be giving in some way or the other. So auricular temporal nerve यहाँ पर इंजूर होती है, and most commonly it is going to go and join with the great auricular nerve, and we know very well the great auricular nerve is going to supply to the skin over the, yes, angle of the mandible over here. So now if the person is going to consume the food, जब वो बंदा, yes, when he is eating the food right now, what is going to happen? Yes, auriculotemporal nerve will be stimulated. It is going to fire, and that is now going to stimulate what? The great auricular nerve. And then what is going to happen? That is supplying to the skin over the angle of the mandible here. So there will be redness and sweating. So that is gustatory sweating over here. So two things that you got to be like very clear here. What is the nerve which is getting injured here in Frey syndrome? The nerve getting injured will be auriculotemporal nerve. But it is most commonly going to join with which one? It is going to join with the great auricular nerve. It is going to join with the great auricular nerve. Fine. So yes, of course, I'm getting a lot of inputs here. Sir, actually in the Frey syndrome, two options were very confusing, Dr. Patel. Okay. Wanted to know only the signs and nerve involved. Okay, Dr. Farishta Zahur. I told you the concept very clearly here. The nerve involved here, the nerve injured here will be auriculotemporal nerve, and most commonly it is going to join with great auricular nerve. You got to see the wordings over there. Okay, gustatory sweating वगैरह होता है. Dr. Demon is saying that parotid surgery will be there. Surgery was given. Fine. Phrase with pain in one option and phrase with meal sweat another option. Okay. It actually during meal in the option. Okay, fine. I'll do one thing here. I'll just take a screenshot of all these options over here and we'll be including this one. I'll come up with the proper options and proper question in that one. Gustatory sweating, flushing was given in here. Fine. Perfect. So there was a question from the radial and ulnar nerve also. Okay, fine. Let us see the other questions also. Yes, moving ahead, of course, great auricular nerve. As I told you, some of the students have said me that, there was an image-based question. Was it right? There was an image-based question about the great auricular nerve, and they have given to identify the great auricular nerve. Is it was given or not, first of all? Yes, sir. Dr. Sunil is telling yes, sir, it was given there. Fine. Fine. So we have already discussed. You let me know the exact question and the options which were given. So as I told you, I kept like 3 questions separately here, where I did not get the exact language of the question and the options there. So great auricular nerve already हमने discuss कर रखा है. For example, if this one here will be the sternocleidomastoid muscle over here, and this is the trapezius here, and this one here will be the clavicle. Fine. So in this one, I'm just writing in short here. This is SCM, sternocleidomastoid, and this one will be TZ, trapezius, and this is the clavicle here. If this is the posterior triangle, then we have discussed in detail that the great auricular nerve will be going from here like this. You also have the other nerves in the roof of the posterior triangle. I'm not concerned about them right now. The lesser occipital, transverse cervical, supraclavicular and all. But right now, the great auricular nerve. Fine. I told you the points to be remembered here. I gave you like 4 or 5 points during the class. Number 1 point here is it is going to run along with, remember the great auricular nerve runs along with the external jugular vein. Point number 1. Point number 2, yes, of course, it is involved in the Frey syndrome. I told you the Frey syndrome in detail just now. Point number 3, remember, yes, they have given similar question previously also in FMG exam that there is parotidectomy, great auricular nerve is injured. One fine morning when the person was shaving, there is a loss of sensation in the shaving area. So loss of sensation in shaving area. This was also given post parotidectomy, after parotidectomy. Yes, about the great auricular nerve. All these points you got to remember, my dear friends. Fine. So that is an important thing. Definitely nowadays they're giving in the exam. In connection with leprosy, it was given. Okay. Let me just take a screenshot of this one also. I'll just try to include the exact question. Fine. But the question was very tricky. Fine. It was marked behind the sternocleidomastoid. Okay, thank you for that one. I mean, you mean to say it was an image-based question which was given here, है ना? Image-based question was given, and this was given along with explanation was given along with the leprosy and all. Fine. For Frey syndrome, the question it was swelling, flushing at the pressure ulnar nerve, and pain due to occlusion. Fine, fine, fine. Dr. Karuna, I'll take care about that one also. Chaliye, next one, sir. Now, the last and final thing, like one more question. Yes, there was mid shaft fracture of the humerus. Yes, did they ask you about the nerve involved here in the mid shaft fracture of the humerus? Did they ask you about the nerve involved here? So, for example, if this is the head of the humerus here, the greater tubercle, and this one here will be the lower end of the humerus with the epicondyles over here. Did they ask you about the nerve involved in this one? Yes, of course. And we know this very well. We have learned that our humerus is actually associated with how many nerves? Remember, it is totally related with the three nerves. And what are the three nerves which are related with the humerus? Number one, there will be axillary nerve. There will be axillary nerve. And number two, there will be a radial nerve. And finally, number three, there will be the ulnar nerve. Ulnar nerve. And we know very well the axillary nerve is the one which is going to pass behind the surgical neck of the humerus. Surgical neck of the humerus. And the radial nerve is the one which is going to pass behind the shaft of the humerus. And yes, of course, it is going to pass through that groove. That groove will be the radial groove or the spiral groove. And finally, my dear friend, ulnar nerve is the one which is going to pass behind the medial epicondyle. Behind the medial epicondyle, ulnar nerve is going to pass from here. So there are three nerves related to the humerus: axillary nerve, radial nerve, and ulnar nerve. Yes, of course. Even in our workbook also there are images which are given with the fracture only. The humerus bone which is having the mid shaft fracture of the humerus, the nerve involved there should be definitely the radial nerve only. Fine. Radial nerve injury was the answer, sir. Dr. Sunil. Thank you, Dr. Sunil here. Yes, the picture of fracture of shaft of the humerus was given and the nerve was asked. Perfectly fine. Perfectly fine, Dr. Patel. Dr. Mohammed, there was an image-based question to identify the vessel or the nerve. And one question was of electromyography and ulnar nerve was given. Okay. I think that electromyography was actually given like, attachment on the medial side here. If I'm right there, Dr. Patel, I think the attachment was on this medial side here, like in the hypothenar and the little finger there. So of course that will be definitely the ulnar nerve involved there. Zygomatic swelling in front of the parotid abscess. Dr. Ajinkya, you're referring to which question here? Zygomatic swelling in front of the parotid abscess. Fine, I'll try to include that question also. Fine with this one here. So these are the three questions where we need to just set up the language, exact language, and I'll get with the exact question back into your, I'll upload in the app also. Don't worry about that one. So it's another question where image-based question on the vessel was given. Okay, okay. Sir, one image was of heart and the vessel was asked. It was also a very different question. Image of heart and vessel. I'm actually listening this for the first time. No one actually recalled this question. Fine. If you're able to recall the complete thing, let me know. Okay, fine, fine. In front of the abscess. Fine, fine. Okay. So by this, actually, we have discussed like all the questions that were asked about the anatomy as well as anatomy integrated with the other subjects also. So as I told you in the middle of this session also, my dear friends, the three take-home points for all the students who are preparing for the December FMG exam, right from the very beginning itself, please try to learn conceptually. So starting 2 months will be very much important. So if you're starting your preparation right now, remember August and September will be extremely important for you. Try to develop all your concepts crystal clearly. So conceptual learning is important, integrated learning is important, and please don't forget to solve the previous year questions of NEET PG, INICET as well as the FMG exam, at least of last 3 years, my dear friend. Last 3 years, we have seen the exact question which was repeated from the INICET this time. Okay. Pulmonary segment resection was given. Okay. Okay, fine, fine. We will come up with a session for the NEET PG also. It is actually scheduled. So I'll try to do the best that I can do for you people. I'm always there with you till your NEET PG exam. Don't worry about that one. Okay. And if you have any constructive suggestions, let me know what can be done for the NEET PG. We'll surely do certain sessions for the NEET PG also. Okay. While cardiac surgery from the posterior aspect, great cardiac vein. Fine, fine. No issues, my dear friends. I'll look into that one. If any suggestions, you let me know that one. By this, we are done with all the questions that were asked in the exam. So hope you have done well in the exam. Now, during these days, try to relax and chill and just wait for your results. Hope you come out with the flying colors. God bless you all. And I wish that every one of you have to pass in the exam, guys. God bless you all. Take care. Thank you.